We're working hard to get you guys the absolute best flower that can come out of this place.
Think big, start small.
Listening to your podcast led me to being a little more active.
It's Reefer Madness, the podcast with Trevor and Kirk.
Kirk, we're back.
Hey, Trevor, how's it going?
Good.
So we're going to talk about dementia.
Yes.
I really enjoyed this conversation. Introduce this gentleman.
All right. Apologies. I'm getting better at his name, but I still don't know if I have it right. Lazslo Mechtler. He is a neurologist. He's many other things. He is a professor of neurology and oncology at SUNY Buffalo. He is a chief of Neuro-Oncology at a hospital called Roswell Park. And sort of the most relevant to our conversation, he is the chief medical officer at the DENT Institute for the last 35-ish years. And they are the largest private neuroscience center in the U.S. And some numbers you were even throwing to me before we went out there, 13,000 neurological patients per day. In Canada, we just don't have anything even remotely of the scale. Well, we don't have big private clinics, and we certainly don't have anything remotely on the scale of the DENT clinic.
Yeah.
DENT Institute.
It's quite interesting. I found he's also a doctor who got pushed into cannabis.
Yeah,
neurologist.
Yeah.
But he got pushed into cannabis because his patients wanted to know about cannabis. And wasn't it that New York had legalized cannabis, medical cannabis, and within a day he started getting phone calls?
Yeah, I think the number that sticks out for me was something like they were getting 500 calls a day. So I guess we got to do something about this. And private medicine, love it or hate it, they didn't have to go through a whole bunch of rigmarole to pivot. They just said, all right, people seem to be interested in that. They're medical cannabis. Let's do something. And that's, a private clinic. They can do that.
Yeah, and essentially they pivoted overnight. And one day they're not doing cannabis. One day they are. And he's a individual who's skeptical about cannabis and stumbles his way into the cannabis field. And now presenting at a CanMed about the stuff that he has discovered through his research in cannabis. Yeah, Trevor, this is a very short conversation. You fit a lot of stuff into this conversation.
I was going to say short, but whether you want to call it dense or efficient, Dr. Lazslo covers a lot of ground in a short amount of time. So you might have to listen to this one a few times, but yes, he's got a lot to say, and he gets through it very succinctly.
Yeah. So let's hit it and come out and discuss what we got out of it.
Absolutely. Here's Dr. Lazslo Mechtler.
So Trevor Schufelt, CanMed 24. We actually have one of the keynote speakers here, Dr. Lazslo Mechtler. I'm gonna get you to say your name properly, so we get it on there. And we're going to talk about cannabinoids and dementia and Alzheimer's. Dr. Mechtler, I'll get you to introduce yourself with your full name first.
Okay. Hi, my name is Lazslo Mechtler. I'm a professor of neurology and oncology at SUNY at Buffalo, chief of neuro-oncology at a cancer hospital called Roswell Park. And my position in regard to cannabis research is that I'm the chief medical officer of the DENT Neurologic Institute. The DENT Institute is the largest private neuroscience center in the United States. To give you a feel for the size, we see 1,300 patients every day in the neurosciences.
Wow.
So by far we're the largest. It's a private institute. I'm proud to say I'm the director of that institute. And we pride ourselves that not only are we private, we do 102 clinical studies a year at the institute, mostly with pharmaceutical companies. But at times we do work with regulatory bodies such as the NIH, NCI. But most of our research is drug-based research in the field of neurology and psychiatry.
That is very impressive. Now, the talk I went to of yours this morning, we can't redo the whole thing here, but can you tell us a little bit about cannabinoids, neuroprotection, and what good things might happen if we get the right cannabinoids into someone with early dementia?
So dementia in this country is going to be an epidemic. As the population of the country not just in the United States, in the world, is getting older. We're living longer. And we're healthier 75-year-olds than we were ever in history. So right now in the United States, there's about 6 million patients with Alzheimer's disease. We have about 12,000 patients with MCI, mild cognitive impairment. What that means, the difference between the two, is in Alzheimer's disease, you have cognitive dysfunction that affects your quality of life.
Okay.
In MCI, you may have some short-term memory difficulties, but it hasn't affected your daily life. You're still driving, you may still go to work, but MCI, unfortunately, can develop into Alzheimer's disease.
Okay.
So the first step is, when we see a patient with cognitive decline, is to rule out reversible dementias. Depression, tumors, vasculitis, strokes, and you go down B12 deficiency.
Okay.
That's the first step. They call it reversible dementias, which are potentially treatable.
Okay.
After you ruled reversible dementias out, then you focus on 70% of dementias today are Alzheimer's disease. Now, Alzheimer's disease diagnosis has changed over the last 10, 15 years. Initially, it was neuropsychometric testing, which is intense testing over several hours to evaluate parts of the brain. MRI, in the past it was CT, but now MRI is more sensitive, looking for specific defects in the brain. For example, in Alzheimer's, you have hippocampal, amygdala, or medial temporal lobe atrophy, as well as parietal lobe atrophy.
Okay.
That's pretty specific for Alzheimer's disease. Now, not every dementia is Alzheimer's disease. For example, frontal lobe dementia, frontal temporal lobe dementia, used to be called Pick's disease, that has superior temporal frontal lobe atrophy. It's a little bit different region. So MRI is very useful to rule out secondary diseases, also very helpful to diagnose primary degenerative disorders such as Alzheimer's disease. The next step is to do, you can do this. The Medicare and the insurance companies don't like it, but it's expensive, is do PET scanning.
Okay.
In the past, it used to be fluorodesoxyglucose, FDG,
okay.
PET scanning to look at abnormal uptake of sugar within the temporal lobe and parietal lobes, classic for Alzheimer's disease. We have amyloid PET right now. Amyloid PET is expensive, but it's doable to see if there's amyloid deposition, because Alois Alzheimer at the turn of the previous century was a psychiatrist as well as a pathologist, and he wrote an article actually called Pre-Senile Dementia in a 60-year-old, and they found beta amyloid plaque, neurofibrillary tangles. And this is the classic abnormality. Now, I have to tell you that if you do a biopsy or have an autopsy on an 85-year-old, the chances that they have pathology similar to that is very common. I would say about 40, 50%.
Okay.
The problem is how severe is the degree of changes pathologically? And number two, the location. Where is it located?
Okay.
But we don't do pathology, let's be fair. Mm-hmm. That's only if somebody has a car accident or medical legal reasons, but rarely we do autopsies on patients with Alzheimer's disease. So how else? Now, you can check, this is something new, spinal fluid.
Okay.
Look for tau or look for amyloid, beta amyloid. So you can do that also. So how do you diagnose Alzheimer's? Clinical history, neuropsychometric testing, MRI, potentially PET, and potentially spinal fluid.
Okay.
Now you have the diagnosis. And the question is, the problem is in patients who are overtly demented, there's not much you can do with somebody with moderate to severe dementia. So you have to catch it early. You have to catch it on the MCI level as it gets into mild. Now, 15, 20 years ago, we had acetylcholinesterase inhibitors.
Right.
We used them for years. Did we see major results? No. It was the only thing we had. These are medications such as donazepam, Aricept, or Namenda.
Yep.
And so we still have those drugs, and may be worthwhile using it at the earliest stages. Now we have these new drugs that have come out. Biogen had a recently drug pulled from the market because the results weren't overly encouraging. But we do have one or two and about four in the pipeline. These are monoclonal antibodies against amyloid beta, and so which is senile plaques. but they have complications. Close to 35% of them have swelling in the brain, area edema, and a percentage of them have bleeds, microbleeds on SWO, which is
not good.
Not major bleeds, but microbleeds.
Okay.
So in people on these drugs, they have to have MRIs regularly. So that's basically the diagnosis and treatment. We're still a long way from having cures. Now, cannabis. The problem with patients with dementias who are admitted to nursing homes when they're agitated or sundowning, they're put on really strong medications such as major tranquilizers, antipsychotics.
Yeah, the Seroquels and Risperidones.
Exactly. And you know what? After they're put on those drugs, their lifespan decreases significantly. So morbidity and mortality is increased with these drugs. It's a way to basically, it's a little bit like hospice care. You put them on Seroquel and they won't last that long. And so cannabis, and we did this study at the DENT, we saw about 185 patients, but after reviewing, we had about 118 patients that received cannabis. This was a 20-to-1. About half of them received 20-to-1. The other one received 1-to-1 ratio of THC to CBD. And we noticed that, first thing, the pain associated with dementias, which is a lot of them are just lying around, decreased significantly statistically, as did anxiety, as better sleep. So we feel that the quality of life issues have improved the use of cannabis. Okay. Now, this is not a prospective study, it's just a retrospective study. And we've done a lot of these studies because right now in our cannabis clinic, we have 13,500 patients actively receiving medical marijuana. So it's a large clinic. We treat a lot of disorders in the field of neurology. Mostly 70% of them is chronic pain. Okay. But we see MS, Parkinson's, Alzheimer's. In fact, we've published on all those groups and geriatric population of patients, 103 still receiving cannabis. So my story or journey in cannabis started when New York State approved cannabis, and I run the largest neurological center, and the initial indications for cannabis, 9 of them were neurological. Right. So I had no choice because we were receiving over 500 phone calls on a daily basis. And after 3 days, it would have broke the bank because everybody was fixated on, do you use cannabis? So really overnight, because we're a private institute, we didn't have we didn't have to turn to a CEO of a hospital or a dean of a university. We just started the cannabis clinic without any experience or knowledge. So the next step after that was that we just built our population of patients, and then with experience, I mean, how do doctors know what to do? Well, they read the literature. But 100 years ago, there was no literature. So they used it by seeing human beings come back and go, and here's this, come back. So it's experience. So I learned cannabis use just by seeing patients. So I started off very much, and I'll admit this, a skeptic. I had no experience in cannabis. I wasn't a user. In fact, I don't even drink alcohol or smoke. I'm a very boring human being, as you can tell. So I went from a skeptic to an advocate. And why am I an advocate? I'm an advocate because when patients come in and hug you and say, you changed my life, I say, that happens once, I'm okay with that. But when hundreds of people come back, and so it really impressed me that there is something there that we haven't catched, and we can't really scientifically figure out because it's a Schedule I drug, which is ridiculous, as you know. And hopefully they'll deschedularize it so we can do prospective studies, randomized studies. And we have to find the right compound, and we have to realize that there's that entourage effect, which means that maybe it's not just THC, but maybe the combination of THCB with the terpene and throw in the flavonoids. We have to find that right combination for the right disorder, and we need to do randomized studies.
Dr. Mechtler, that was fantastic. Thank you very much.
My pleasure.
So one of the other numbers that you liked was, or commented on, was 102 clinical studies per year. Now, whether you like it or hate it, and I know you have your feelings, most of them are funded by pharma companies, big drug companies, which makes sense. They fund most medical research in North America, probably around the world. Some through the NIH, the National Institutes of Health, and other regulatory bodies. That's a lot of clinical research.
That's a lot of clinical research. Again, I come from a Canadian system where a lot of research is funded by universities, funded by government. So in those situations, usually you have to go through an ethical review before you get the funding or the approval to do the studies. There's so many questions I'd like to ask the fella about their research, and what is the process of doing research in a private, I guess, for-profit research center doing research for pharmaceutical companies that are obviously for profit. So I'm a little suspect on how they get their ethics, or how they get their ethics approved, or how their studies going. But having said that,
I'm talking out of my hat here, but they'll absolutely have ethics review there too, because especially if it's a drug that you eventually want to bring to market, the regulators will eventually say, yeah, you did those, take some ludicrous thing from the past. You did those all on prisoners. You should, so there will absolutely, I've never been around the DENT Institute there. But I guarantee there is an ethics review board there.
Oh, I'm sure. Well, I'm not, I guess I don't want to say it as criticism. I spoke up front. I'm coming from a Canadian system. So having gone through the system to get ethical research done, I'm curious. I'm very curious on what the process for a private institution to get research done. What is the process from their ethical perspective? That's my intent. But having said that, what I'm really impressed by, Trevor, is the fact that this organization one day knew nothing about cannabis, but could pivot so quickly to have what? They've got you said 13,000 patients a day. They're doing 120 research a year. 13,000. They're doing research right now where they've got 118 patients receiving cannabis in a research of over 185 patients.
Yeah, that was one of their studies. So the 100. But before we go over that one though,
go ahead.
Just because it was so dense, let's just do a little bit of terminology in case people sort of missed it. So MCI, we talk about that a lot. So that is mild cognitive impairment. So this is not yet dementia. You might be forgetting some stuff, but you are still able to function. You're still able to go to work. You're still able to look after your kids, still able to cook, still functioning. And why that's a big deal, at least in Dr. Mechtler's thought, is that seems to be the place to intervene, especially with cannabinoids, because that seems to be a place where we can actually do some good. The other, and I'm sure it was a misspeak on his point, but he talked about being about 6 million people in the U.S. having Alzheimer's, and that's about 70% of all dementias. That rings true, but he said about 12,000 people with MCI. A quick Google said no, he meant there's more like 12 million people with MCI in the US, so the mild cognitive impairment, so there's lots of those. So I just thought I'd throw a couple of those out. There's lots of other cool stuff in there, but just I think some of those, in case you don't talk about people with dementia every day, some of that terminology might have gone over your head.
Yeah, this is another good episode on dementia. When you start thinking about how many we've done episode 99, episode 91, episode 58. These were all about dementia and cannabis. Getting to the cannabis part of this, what I find really cool is some of the things that they have found. They've got, I think, the 13,000 patients actively using cannabis right now within their studies. 13,000.
And that wasn't just dementia, so that's dementia and Parkinson's and MS, like 13,000 sort of total neuroscience patients.
Right. But what I liked about it is that what they're finding is people's anxieties are decreased. People are getting more sleep. They're feeling less pain. I think we have to review. People that have listened to the other episodes understand that overtly demented people are often heavily sedated or given very strong medication to control their sundowning, right? So I think we have to remind our listeners that that's one of the biggest problems with dementia in the current system, is how we control them through chemistry.
Yeah, we use drugs that weren't intended for dementia. We use drugs like Seroquel and Risperidone, and they do quiet the patients down, but literally study after study says that if you use these drugs in older patients, you decrease how long they're alive. You increase mortality. You kill them off faster. So
so cannabis,
and no one is trying to kill. No one's trying to kill off grandma. I'll throw that out there. But you can sympathize with. We'll throw a nurse. If grandma, when she's having a bad moment, is picking up her cane and winging it at people again and again and again. What do you do about that? You could increase the nursing staff so grandma has lots of one-on-one time with a nurse or nurse's aide. That would be ideal. But more often than not, they get some of these medications that do sedate grandma, but decrease her probable length of life as well.
Well, and what he discussed is how there's these microbleeds that occur in the brain that are discovered with MRIs.
That was different and interesting.
Okay.
So there are new drugs out there which we throw monoclonal antibodies at everything now, right? Because they're very, very specific, targeted. There was a Biogen drug which was pulled off the market, which was a anti-amyloid antibody thing, a monoclonal antibody, because it was just questionably be effective. And there's 4 more of these monoclonal antibodies in the pipeline. The idea makes sense. We've got these beta amyloid plaques, these protein tangly things in the brain. If we could get rid of them, shouldn't that improve Alzheimer's? That's kind of the idea. The problem is they are having some side effects, including brain swelling and microbleeds. So, these are the next great thing, and they really might be. So let's not throw the baby out with the bathwater, but they are not they're not without their issues.
Mm-hmm. And there's that little baby plant that grows almost anywhere that decreases the pain and makes it much easier. So as a nurse that's responsible for these people, providing them a medication that calms them, decreases anxiety, allows them to live longer, that just seems like a no-brainer. And the fact that this organization has pivoted so quickly to focus on cannabis, I'm impressed, especially when they start talking about there's an epidemic coming. I mean, our generation, we will probably be the longest living generation, right? Without getting into demographics, but my understanding is our spawn aren't going to live as long as we are, right? So our generation is the last of the ones that gets to 105, 110, and we're the healthiest 75-year-olds out there right now. I mean, I'm closer to 75 than I am 30, so I mean, that's I'm one of those guys that's going to end up in the fields of these long-term care organizations, and hopefully there's enough science to say, give the guy cannabis, keep him off that sedative, And so I just think from a perspective of a practitioner, cannabis is becoming a no-brainer, and it makes me wonder why more and more health authorities aren't advocating for it.
No, I agree. And we didn't have time to get into it. He had a whole great big long talk that I went to before. But we've sort of covered this ground before, which is instead of giving risperidone to people in care homes who have dementia to calm them down, cannabis seems to be a good alternative and safer. And, like you said, even in their study of those 118 people with cannabis, they had half with a 20-1 CBTHC and half 1-1. And they were finding, less pain, less anxiety, less sleep. So all things that would make you agitated. And so that's all good. But there's also, far from proven, but if we give the right cannabinoids to these MCI people, these mildly cognitively impaired people, some cannabinoids seem to have some neuroprotective effects that might actually delay or prevent Alzheimer's/dementia. Now that's a whole lot of mights and maybes, but that is another thing that people like at the DENT are looking at, and that might be even more exciting than treating people with dementia with cannabinoids to keep them happy. Maybe if we treat people who are mildly cognitively impaired with cannabinoids, maybe they will get dementia later or not at all. So that's a cool thing that might be happening.
There's a lot of stoners who are gonna say, "Told you so, man." It's only the short-term memory that goes.
Yeah.
It's another good one, Trevor. It
adds
to
like I said, very very dense. Go listen to that again. He goes through a lot of stuff.
Yeah.
But efficient use of your time.
Yeah, it was a good interview, and it just goes once again as a nurse to my practice. Cannabis has a role, and you know what? We're so cautious sometimes because we want those random trials and random controlled trials, but we're starting to get enough experiential, subjective research that suggests cannabis is worth trying, right? So if you do have an elderly relative or friend in a long-term care facility who's showing signs of dementia, start educating the staff on cannabis. Hey, they could refer them to this podcast, Reefer Madness, the podcast.
They could.
I have a story to tell you.
Sure.
I'm going to name drop Dan McKay.
Okay.
McKay Yardworks and pressure washing. He does yard work,
Yes.
shovel stuff, right? I'm in my
Yes.
backyard today, so it's been very wet. So the yard is full of grass, and so I was out mowing mine, and my neighbor had hers done by Dan by McKay's Garden Works, and he listens to our podcast.
Huh.
So he came up to me and
I knew it like Dan before that. I like him more now.
Yeah. Well, Dan and I used to work in corrections together back in the day before they closed the local jail, which I'm sure in one of the podcasts we talked about 4 years ago. But yeah, so Dan and I know each other, and he's pivoted into a new business, and he's very successful. McKay Yardworks, a little name drop, but what he basically said, he came up to me in a classic Dan way. He goes, "Yeah, been listening to that there podcast of yours." Yeah, Dan goes, "Boy, I learned a lot. You had that one about that person, I think from Seattle, talking about CBD or something, and I learned a lot." And so he's just started naming off episodes going, "I didn't know you could learn so much about cannabis."
Cool. Thanks, Dan.
He likes our podcast. Yeah, thanks, Dan. So I thought that would be a nice little plug for Dan. And unfortunately, he's not web-based. You'd have to live in Dauphin or the Parkland region to use his services. But look up McKay Yardwork. He's a podcast listener.
And so, Kirk, I don't have any music picked out for this one. Anything tickling your fancy?
Well. We are talking about cannabis research. I don't know. I think it's still yacht rock. I mean, it's still a Florida episode, right?
It is.
So we should why don't we get, how about Christopher Cross sailing?
Sure.
Is that just too yacht rock for you?
No. Well,
or maybe we'll let Renee can do it.
Well, yeah. Wrap up yacht rock with "Come Sail Away."
Sure. No, that's a different band. Come Sail Away.
Okay.
Chris Cross is. We'll let Renee figure it out. Hey, I'm Kirk Nyquist. I'm the registered nurse.
I'm Trevor Schufeld. I'm the pharmacist.
We are Reefer Madness, the podcast.
All right. Here's another good one. See everyone next time. Have a good day.
Well, time to blow this joint. Like the show? Let us know. We're Reefer Madness on Instagram and Facebook, at Reefer Madness on Twitter, or head over to the website at reefermed.ca to find out what we're all about and what's coming up next. Talk to you later.
But it's not far down to paradise. At least it's not for me. If the wind is right, you can sail away and find tranquility. Oh, the canvas can do miracles. Just you wait and see. Believe me. It's not far to Never Land. No reason to pretend. And if the wind is right, you can find the joy. Oh, the cannabis can do miracles. Just you wait and see. Believe me. Sailing takes me away to where I've always heard it. Just a dream of the wind that carried me. Soon I will be free. Fantasy, it gets the best of me when I'm sailing. All caught up in the reverie. Every word is a symphony. Won't you believe me? Sailing takes me away to where I've always heard it. Just a dream of the wind to carry me. Soon I will be free. Well, it's not far back to Santa Cruz. At least it's not for me. And if the wind is right, you can sail away and find serenity. Oh, the cannabis can do miracles. Just you wait and see. Then you believe me. Sailing takes me away to where I've always heard it could be. Just a dream of the wind to carry me. Soon I will be free.
This getting up on Monday to Friday, man, kills me.